From stories around the world to stories here at home, this is the National News Broadcast. A pleasant evening. I'm Delanjali Ananda.
A very good evening indeed. I'm Charithamin Prarachi, and let's move on to the headlines for tonight's news.
All schools in the country will be closed until April 30th. No shortage of oxygen in the country, Health Ministry confirms. Government decides to ban full face coverings in public places. Courts grant approval to detain and interrogate Rishad and Riyaj for a period of 90 days. COVID-19 deaths in India nearing 200,000 grim milestone. Indian government summons the army to resolve the oxygen supply issue.
On to those and other stories in detail now, and starting off with the local update of the COVID-19 pandemic. The Ministry of Education has reached a decision to close all schools, private institutions and educational institutions, including preschools and tuition classes in the country until April 30th. The Archdiocese of Colombo also announced that all Catholic schools will also be closed during the said time frame. Schools in western and northwestern provinces and Galle and Trincomalee districts were closed down today, while a low attendance of students were reported in schools in other areas. The government has made the decision considering the detection of COVID-19 infected patients among school children in many areas and prevailing situation concerning to the spread of the disease. The epidemiology unit has indicated that the spread of the virus has increased compared to the previous occasions. Taking part in the national television's Ayubowan Subhadavasak program this morning, Dr. Sudat Samaravida said that the transmission of the virus from one person to another person has escalated.
ඒ වගේම මේකට පාදක වෙලා තිබ්බේ නැගෙනහිර කොළඹ මූලික රෝහලේ ඔක්සිජන් හිඟයක් තියෙනවාද කියන කරුණක් මත ඒ රෝහලෙත් ඇත්තටම
A report was published today on a national newspaper and on social media over an alleged shortage of oxygen in Kalubowil Hospital. Director General of Health Services Dr. Asela Gudavardhana dismissed the report and claimed it to be baseless. A circular was issued this evening ensuring the continuation of the state service without an interruption. The necessary recommendations have been presented considering the guidelines issued by the Ministry of Health. The circular was issued by the Secretary to the Ministry of Public Services, Provincial Councils and Local Government Institutions, J.J. Ratnasiri. A total of 674 COVID-19 patients were detected today. Meanwhile, 279 recoveries were also reported today. So far, the total recoveries in the country has increased up to 94,856 and at a percentage of 92.05. A total of 7,547 COVID-19 patients are still receiving treatments in hospitals. Meanwhile, Siriketha Gramirdhari division belonging to Higurakoda Police Division in Polonnaruwa was isolated today after reporting 23 patients. Steps have been taken to direct 1,119 persons belonging to 315 families in the area into quarantine. The Ukuela Palle Kumbura Gramirdhari division in Matale has also been isolated. A total of 40 COVID-19 patients have identified from this area. In the meantime, a total of 108 persons have been taken into custody yesterday for violating quarantine regulations. A total of 3,755 persons have been taken into custody for such violations thus far. Meanwhile, Colombo District Secretary Pradeep Yasaratna has requested the public to use the online technology to obtain state services as much as possible. Minister Namal Rajapaksa has mentioned that all sports-related training
පටහැනිව කටයුතු කරනවා නම් එයයි සම්බන්ධයෙන්
අපේ ප්‍රාදේශීය ලේකම් කාර්යාලය නිසා දිස්ත්‍රික් ලේකම් කාර්යාලයෙන් ලබා ගන්නා බොහෝ සේවාවන් කාර්යාලයට නොපෙමිණිලා ඒවා ලබා ගැනීම සඳහා ජනතාවට අවශ්‍ය පහසුකම් මේ වෙනකොට
Minister Namal Rajapaksa has mentioned that all sport-related training can be taken place adhering to health guidelines. Minister Namal Rajapaksa said that a list of recommendations related to sporting activities have been issued. He added that international tournaments can be held through the bi-bubble system, while other rural-level sporting activities can be held with the recommendations directed by the medical health officers of the relevant divisions. He also said that all sports-related training can be held in small groups while adhering to the instructions of the MOH officers.
ප්‍රදේශයට ආවෙනික පැහැදිලිව අපිට ලංකාවටම මෙන්න මේක තමයි අද ඉඳන්
Bringing you the global update of the COVID-19, The first shipment of emergency medical supplies have arrived in India as hospitals are struggling to cope with the mounting coronavirus cases. Meanwhile, COVID-19 has surpassed more than 3.1 million death rates and infected on 148 million others globally.
International aid has been arriving in neighbouring India, while number of countries have pledged to join the fight against COVID-19 as the country's healthcare system pushed to the brink of collapse by a deadly second wave. A flight from the United Kingdom carrying vital medical supplies, including crates of ventilators and oxygen concentrators from the United Kingdom, has arrived at an airport in the Indian capital of New Delhi today, while 6 oxygen containers will also be flown in from Dubai. It is the first emergency shipment of medical supplies to arrive as a part of a global campaign to bolster the country's healthcare system. Subsequently, President Joe Biden has expressed America's steadfast support to India by providing oxygen-related supplies and vaccine raw materials. Meanwhile, India expects to secure a 60 million AstraZeneca COVID-19 vaccine doses that the United States will share globally. India has been overwhelmed by a huge surge in COVID-19 infections. New infections remained above 320,000 and a further 2,771 deaths have been reported during the past 24 hours. Meanwhile, according to a statement from China's Ministry of Foreign Affairs, Beijing will help South Asian countries to procure coronavirus vaccines. In a video conference with the foreign ministers of Afghanistan, Pakistan, Nepal and the Sri Lankan health officials, the foreign minister of China stated that the country is willing to set up an emergency supply reserves with South Asian countries in the fight against COVID-19. The Australian Prime Minister Scott Morrison said today that Australia has suspended direct flights from India to prevent more virulent coronavirus variants from entering the country following a surge in positive cases in the world's second most populous nation. The suspension of direct passenger flights between the two countries will remain until the 15th of May. As the pandemic has spread across the globe, the virus has left a trail of deaths in its wake. Deaths in Europe and North America outnumber Asia. Reportedly, in Latin America, South America and the Caribbean, the share of global deaths is still rising.
And meanwhile, healthcare workers in Nepal grappled with the rapid rise of COVID-19 cases today as experts fear that thousands of people in the Himalayan state have caught the more infectious mutant strains emerging out of India.
Over the border from India, Nepal is struggling to contain a rapid rise of COVID-19 cases. The Himalayan state reported over 3,000 new infections on Sunday, the highest daily surge recorded this year. Experts fear that more infectious mutant strains emerging out of India are spreading across Nepal. Vijaya Adhikara's husband is struggling to breathe, but despite being at the hospital, they're struggling to get help. In the capital, Kathmandu, the hospitals are feeling the strain.
We brought him to the hospital in an ambulance as he was facing breathing difficulties. The doctors haven't attended to him. Everyone is busy.
Nepal launched its vaccination campaign in January and gave shots to 1.9 million people. They were all provided by India and China. But health experts fear that the vaccines are running out after officials failed to get hold of more vaccine from India or any other source. Over 90 developing nations, including Nepal, rely on India for the doses to protect their own populations. But India has now prioritised its own need as a second wave of the epidemic there has run out of control. A public health expert warns that if the trend continued for a week in Nepal, then new patients will be unable to find any beds, with one local doctor saying the country risks becoming a mini India.
The Director General of WHO Dr. Tedros Ghebreyesus says that the COVID-19 pandemic continues to intensify globally and the situation in India is beyond heartbreaking. Speaking at a regular press conference in Geneva yesterday, the WHO chief said there were almost as many cases globally last week as in the first 5 months of the pandemic.
Globally, the COVID-19 pandemic continues to intensify. Cases have now increased for the 9th straight week, and deaths have increased for the 6th straight week. To put it in perspective, there were almost as many cases globally last week as in the first 5 months of the pandemic, and the situation in India is beyond heartbreaking. WHO is doing everything we can, providing critical equipment and supplies, including thousands of oxygen concentrators, prefabricated mobile field hospitals, and laboratory supplies. As I mentioned on Friday, WHO has redeployed more than 2,600 staff to support the response on the ground, providing support for surveillance, technical advice, and vaccination efforts.
Meanwhile, WHO's COVID-19 technical lead Maria Van Kerkhove said that the exponential growth of cases in India is truly astonishing.
The situation in India is really heartbreaking, as the Director General has said, and the exponential growth that we've seen in case numbers is really, truly astonishing. We have seen similar trajectories of increases in transmission in a number of countries. It has not been at the same scale, and it has not had the same level of impact and burden on the healthcare system that we've seen in India, but we have seen similar trajectories where the incidence was almost vertical if you looked at that epi curve. This can happen in a number of countries, in any countries, if we let our guard down.
And meanwhile, State Minister Professor ChannelEye Rupavahini says that a decision has been reached to administer the second dose of the Oxford AstraZeneca vaccine from tomorrow onwards. State Minister Professor ChannelEye Rupavahini said that the second dose of the Oxford AstraZeneca vaccine will be administered to frontline health workers from tomorrow morning. He said that a total of 350,000 doses of AstraZeneca vaccine are available with the health authorities to be given as the second dose under the inoculation program. He said that the available quantities of doses are adequate until the end of the month of May. He added that all necessary measures will be taken to administer the second dose according to the order of the National Immunization Program. He also said that necessary measures have been taken to import the required doses of vaccines into the country from the program in future.
Chairman of the State Plantation Corporation, Srima Vijayasekara, says that steps have been taken to pay 1,000 rupees wage for all plantation workers attached to the Plantation Corporation. He made these remarks during a media briefing held in Colombo today. Coordinating Secretary to the Prime Minister, Sendil Tondaman, said that the opposition Tamil MPs have claimed that the estate workers have not received 1,000 rupees thus far. He said that the government has paid the 1,000 rupee wage for the estate workers since last Friday through the State Plantation Corporation. He added that a total of 3,800 workers have received the wage at present. He extended his gratitude to Prime Minister Mahinda Rajapaksa for fulfilling the request of the estate workers accordingly.
ගරු මහින්ද රාජපක්ෂ ආවිතුමා මේ කම් කරුගේ ඉල්ලීමක් පරිදි මේක දැන් උදව් කරලා තිනවා ඒ නිසා එයාට අපි විශේෂම ශ්‍රූතිය කියනවා. රජයගත තීරණය අනුව
Chairman of the State Plantation Corporation Srima Vijayasekara said that according to the decision of the government, State Plantation Corporation has made the complete payments for the estate workers for the month of March. He added that a total of 16 estates, especially surrounding Kandy and Mathali districts, function under the State Plantation Corporation. He said that the State Plantation Corporation has been able to pay the daily wages as well as other relevant payments for the estate workers without fail.
A program to build a well-trained workforce for state institutions to implement future development activities in the country in an efficient and expedient manner has been initiated under the instructions of Prime Minister Mahinda Rajapaksa. This initiative, implemented under the 2021-2030 Skills Development Index, has been titled as Empowerment of 2020 Workforce. The new initiative was inaugurated in Kalkulam, Radhapura recently. The relevant project will be initiated by the Construction Industry Authority under the guidance of President Gotabaya Rajapaksa and Prime Minister Mahinda Rajapaksa. Through the coordination of State Minister Indika Rudda and Secretary to the Urban Development and Housing Ministry Srinimal Pereira. The program will be initiated under 3 projects named Shramasikuru, Nipuna Shakti and Saini. The Shramasikuru project consists of 2 phases and a total of 4,191 workers expected to receive training under the first phase. Financial provisions worth 80 million rupees have been allocated for this phase. The trainee workers will be directed to suitable institutions for employment following the completion of the training. A new project titled Multi-Purpose Construction Skills Training Opportunities expected to be initiated jointly by the Minister of Sports and Youth Affairs and Construction Industry Development Authority. Plans have been made to provide training for 1,000 workers on free of charge under this initiative.
Senior journalist Sudev Hettiarachchi has been appointed as the Director General of the President's Media Division. Sudev Hettiarachchi, who received the letter of appointment from President Gotabaya Rajapaksa at the Presidential Secretariat, is due to assume duties next week. A distinguished alumnus of Ananda College, Colombo, Sudev Hettiarachchi is a full-fledged journalist with extensive experience. With an over 25-year-long career in the media field, he is a popular announcer and producer. He is an efficient administrative officer who had served in the capacities of assistant manager, assistant general manager, director and CEO in several leading media institutes. Senior journalist Sudev Hettiarachchi was the chief executive officer of Swarnavahini Media Network prior to his appointment as the Director General of President's Media Division.
State Minister Ajit Niwad Kabral says that the government expects to attract investments worth more than $50 billion into the country through the Colombo Port City project. He made these remarks while taking part in the Business Today program. This feature program will telecast on Channel I of the national television at 10 p.m. tomorrow.
Today we will be touching on a very important topic, which is the Port City Bill.
What is envisaged in this bill is to provide a single window facilitation unit for all who are conducting business or operations within that port city. If we are to attract more and more foreign investment to come into this country, we have to show a type of efficiency and effectiveness to all who come here. We believe that in the next 5 years, the port city has the ability and the base to attract at least $15 billion. Now that won't come easily. That will come only with proper support being given to these investors. So that is the key. And in so doing, we got to ensure that they will have the necessary expertise, that the necessary laws will be in place, that the necessary empowerment will be there. And that's what this bill entails.
The government has reached a decision to ban full face coverings in public places. The Cabinet of Ministers has granted approval to draft a bill with relevant regulations. Cabinet spokesman Minister Dr. Keheli Rambukwala made these remarks while addressing a media briefing held this evening to announce the Cabinet decisions. Cabinet spokesman Minister Dr. Keheli Rambukwala said that the Cabinet of Ministers has granted approval to present the draft bill formulated by the Ministry of Public Security to ban full face coverings in public places. He said that many countries have resorted to implement such initiatives considering the national security thus far. He also said that several dialogues in this regard were also surfaced in the recent past. The Cabinet of Ministers has granted approval to establish a national loan securities institution to direct assistance for small and medium-scale entrepreneurs. The relevant proposal was presented by Prime Minister Mahinda Rajapaksa. Accordingly, the loan securities institution will function under the Ministry of Finance. The Cabinet of Ministers also granted approval to introduce reforms to the mediation board mechanism. The aim of this initiative is to reduce the high number of existing court cases. Accordingly, separate mediation boards will be established under lands, financial disputes of migrant workers' families and issues pertaining to local government institutions.
The courts have granted permission to detain and interrogate parliamentarians Rishad Badruddin, who is currently under custody, and his brother for 90 days starting from today. The relevant order was issued after considering the submissions presented by the Criminal Investigations Department regarding the relevant investigation. Police media spokesman T.S. Jajit Rohana said that following the arrest of the suspects, an order was acquired to detain and interrogate them for a period of 72 hours in accordance to Terrorism Prevention Act. He added that his said period was concluded this morning, and accordingly another order was obtained for a period of 90 days as per the Terrorism Prevention Act to detain and interrogate the relevant suspects. He said that the relevant arrests were made following the evidence revealed during the investigation conducted on the suicide bombers responsible for the Easter Sunday attack. He said that further investigations will be conducted by the CID along with the TID in this regard.
Ministry of Trade has indicated that the world's first face mask, which could eliminate the COVID-19 virus, will be issued to the market from tomorrow. The new face mask is an innovative discovery of the University of Peradeniya. The new face mask consists of 3 layers. This mask has the ability to prevent coronavirus from entering into the human body as well as to eliminate the virus completely. The new face mask can be washed up to 25 times and has the durability of 2 months. While the University of Peradeniya holds the patent for this product, the distribution of the product will be carried out through State General Trading Corporation. The product has been directed to Imperial College House in United States to obtain relevant recommendations. Another innovative product which can identify coronavirus instead of PCR tests will also be introduced in this occasion.
A delegation of Sri Lankan Buddhist monks arrived in the country yesterday after successfully completing a goodwill visit to Pakistan. The delegation, which was on a tour from April 19th to 26th, was welcomed by High Commissioner of Pakistan, retired Major General Muhammad Saad Khatib, upon arrival. The tour of the 11-member delegation was organized by the High Commission of Pakistan in Colombo in an effort to enhance people-to-people contacts and bilateral Buddhist religious tourism. The High Commission expressed his gratitude to the delegation for undertaking the tour and the government of Sri Lanka for facilitating the same. He underscored that the meetings of the delegation with the President and Prime Minister of Pakistan reflected the strong bilateral relations and deep commitment of the leadership and people of Pakistan towards Sri Lanka. On behalf of the delegation, Chief Incumbent of the Gangarama Temple, Venerable Dr. Kirindaya Sajithera, also expressed gratitude to the Prime Minister of Pakistan and the High Commission of Pakistan in arranging the tour, which provided an opportunity to visit and experience the Buddhist heritage and relics in Pakistan. The Venerable Tera highlighted that the Pakistani authorities and officials were also keen on their views and recommendations on improving facilities for Buddhist pilgrims in the country. And with that, we conclude tonight's news. Do it just tomorrow at the very same time. Stay safe. Good night.